So hi everyone, I am thrilled to have today joining us Dr. Jonas Sokolof, who is a physiatrist trained in physical medicine and rehabilitation. He has 15 years of experience in oncological rehabilitation at Memorial Sloan Kettering and the Rusk Institute. Dr. Sokolof is skilled in lifestyle medicine and functional medicine. He believes in the power of hands-on care, specialized exercises, and the concept of lifestyle medicine, especially for anyone with cancer treatment-related side effects. Today's presentation is called Lifestyle and the Impact on Cancer Survival. The description is that there's a wide body of knowledge surrounding the role that lifestyle, diet, exercise, stress, sleep, etc., plays in our overall health. This is especially true in cancer care. This lecture will focus on some of the major principles of lifestyle optimization to improve outcomes in the fields of oncology. Learners will gain insight regarding how diet, physical activity, stress management techniques, and sleep optimization can help them improve physical function and well-being throughout the cancer care continuum. So Dr. Sokolof, we are so thrilled to have you, and the floor is yours. Thank you again. Oh, also, you were referred to Woman by one of our community members. I always think that's really important for everyone to know. This is not someone who we just sort of found on the internet, that he cared for someone that's really important in our community. And so we are thrilled to learn from you. Thank you again.
Well, thank you so much for having me. It's really an honor to be here with you all. I'll go ahead and share my screen. All right, great. So yes, thank you for that introduction. So Jonas Sokolof, I'm a physical medicine rehabilitation physician. Another term for what I do is physiatrist. So in physiatry, it's a medical specialty that focuses on the enhancement of physical function and quality of life for anyone who may be suffering from some sort of physical impairment, whether that's related to a disease process or an injury, such as a traumatic brain injury or spinal cord injury. Happens to be a very multidisciplinary field, encompassing orthopedics, internal medicine, neurology, rheumatology. We have to know a lot about a lot of these different types of fields and how they all play a role in enhancing function. After I did my physical medicine rehabilitation residency, which is 3 years long, before that I had to do an internship. So after that 4 years of training, I decided to do a fellowship in sports medicine. And I thought I was going to be, treating weekend warriors and doing sideline coverage and seeing athletes and treating low back pain. I was trained in interventional procedures such as epidural injections and so forth. But I realized sort of early on in my fellowship that that wasn't really going to cut it for me as far as providing for a meaningful career. And there was a cancer center in Manhattan. I'm sure you guys have heard of Memorial Sloan Kettering, and they were looking to bring on another physiatrist in their cancer rehabilitation division. And I was fortunate enough to have been offered the position there and stayed on board there for about 10 years and then moved on to NYU, where I was the director of oncological rehab and helped build a program there. I'm a Long Island guy, and I was sort of looking for a better commute and also really looking to build programs, which is really where my passion is. So I ended up joining this health system here on the island called Catholic Health, St. Francis Hospital. And I've been here since January of this year, where I'm building a program in oncological rehab. I'm an osteopathic physician by trade. For those who don't know what a DO is, in order to practice medicine in the United States, you can have one of two degrees. You can have an MD or a DO. DOs, essentially, we learn we have the same sort of curriculum as an MD, but we learn a different philosophy that's more holistic. We believe in the body's innate ability to heal itself. So in addition to learning how to treat patients using conventional medical care, such as medications, surgeries, and so forth, we also learn a form of treatment called osteopathic manipulative treatment or osteopathic manipulative medicine. We actually literally use our hands to help realign the body to help restore balance and health in the patient. I happen to be very interested in that osteopathic philosophy. Most people who go to DO school, they're not really interested in it. They just want to practice like a regular physician. That's probably why, if you haven't heard of what a DO is, that's probably why, because we blend in, we can enter any medical field and we can, practice, just like MDs do. I really gravitated towards that philosophy. I've always sort of been more holistically minded, which really drew me to this evolving field of lifestyle medicine or functional medicine, which I'd like to provide an overview for you guys here, explain how this field is relative to what we do in oncological rehab, and then we'll discuss some of the basic principles of lifestyle medicine, and hopefully you'll come away with some good pearls on how to incorporate this into your own life, maybe into your own medical care, be an advocate for yourself in your own care. So functional medicine, what is functional medicine? Functional medicine essentially is medicine that addresses the underlying cause of disease. It uses a systems-oriented approach as opposed to a more of a reductionist approach where you're kind of focusing on just one system. It really takes into account how all the different biological systems interact together. It takes into account the engagement of the patient and the practitioner as a therapeutic partnership. And I think Thomas Edison really said it best when he so eloquently said, the doctor of the future will give no medication, but will actually interest his patients in the care of the human frame, diet, and in the cause and prevention of disease. So in functional medicine, actually in osteopathic medicine as well, we focus on really what the root cause is rather than sort of just treating symptoms or treating dysfunction. At the foundation of functional medicine, we have what's called lifestyle intervention or lifestyle medicine. And what you see on the slide here are all the pillars of lifestyle medicine. So literally what you put into your body, the food that you consume, your nutrition, how much physical activity you get, your emotional state, the amount of stress that you have in your life, how much sleep you're getting, and the quality of your sleep, your habits, toxic habits, alcohol consumption, smoking, and other substance use. And then there's this emphasis on behavioral intervention, social and interrelationships as well, playing a role in how we in our health. Now, unfortunately, we do know that cancer incidence, unfortunately, is increasing. We've gotten better at curing some cancers. We have gotten a lot better at prolonging life, but we still have a ways to go. And unfortunately, cancer patients who have been diagnosed with cancer and go through the cancer care continuum have a need for rehabilitative care in the sense that they have lost some ability to function. They may suffer from fatigue. They may have neuropathy. They may have certain pain conditions. They just may struggle a bit with kind of returning to their life or maintaining whatever quality of life that they once had as they're going through the whole cancer care continuum. And that's what we do in oncological rehab. It's a branch of rehabilitation medicine that's integrated throughout the whole entire cancer continuum from the time of diagnosis all the way through treatment, cure phase. And it's delivered by trained rehabilitation professionals, hopefully a trained rehabilitation physiatrist. And within our scope of practice to treat the physical, psychological, and cognitive dysfunctions or impairments that we see in oncology. And the goal is to optimize physical function and quality of life. Now, if we break it down by cancer type, for certain types of cancers, breast cancer, for example, we may see patients after lymphadenectomy, lymph node removal. We may see lymphedema. We may see chronic pain in the chest wall after mastectomy. This is not guaranteed, but this is some of the conditions that we see. Just to give you a sense, in our prostate cancer patients, we see a lot of fatigue and deconditioning. We see a lot of back pain. In our head and neck, we see difficulties with opening the mouth, a lot of scar tissue in the head and neck region. In our GYN cancers, we may see lower limb lymphedema, neuropathy from some of the neurotoxic chemotherapy agents that are delivered in this population. We may see pelvic floor dysfunction, sexual dysfunction. And fatigue, I think we see across the board. I mean, usually at some point or another, folks who have a cancer diagnosis or treatment do tend to suffer from fatigue at some point or another. In lung cancer, we not only see fatigue, but we'll see a lot of physical deconditioning, exercise intolerance, post-thoracotomy pain after surgery, and spine pain, sometimes from metastases. Just to kind of give you a sense of some of the different conditions that we deal with in the population. Moreover, we see ubiquitously, we tend to see all cancer patients tend to have some level of what we call physical deconditioning and muscular deconditioning. So we see a decline in their aerobic capacity, this concept of VO2 max, literally how well their body can deliver oxygen to their tissues, right? That seems to be something that we encounter almost always and is compounded by the effects of various cancer treatments such as chemotherapy, radiation, and so forth. Muscle wasting, again, very common, just from the lack of physical activity and sometimes from direct effects from cancer treatment. Fatigue, I think I mentioned before, really universal, and just an overall decline in physical function. As rehabilitation professionals, rehabilitation physicians, and other rehab professionals, we are here to help with that. We are here to help correct a lot of these functional impairments. And one of the ways we do that is trying to get patients more physically active, because we actually know from very robust scientific studies that exercise actually works as a medicine. Not only does exercise help prevent cancer, but it can actually help prevent recurrence of cancer, and it can actually help improve what we call cancer-related health outcomes. A lot of biochemical and physiological reasons why this occurs, but some of them to be mentioned here are obvious and some are not so obvious, but obviously exercise has the potential to reduce body fat, lowers insulin levels, insulin resistance, helps improve metabolic function, lowers sex hormones that are often involved in some of these hormone sensitive cancers, GYN cancers, for example, lowers growth hormones, growth factors that are involved in cancer propagation and development, also lowers the various chemicals, the cytokines that are involved in obesity. And it also has the potential to lower inflammation. We know that inflammation tends to be a driver in many instances for cancer. We know, again, from very, very sound scientific studies that physical activity exercise has been associated with a lower risk of developing colon cancer, breast cancer, endometrial cancer, kidney cancer, bladder cancer, esophageal cancer, and stomach cancer. That's very strong evidence now to support that. There's some moderate evidence to suggest that exercise actually is preventative for lung cancer as well. We know that being sedentary, there's moderate evidence that not being physically active actually increases your chance of developing endometrial, colon, and lung cancer. So it's very important to be physically active. We know it actually, again, it is a type of medicine. More importantly, for what we do in rehabilitation medicine and improving quality of life and function, we know that exercise helps reduce anxiety, helps improve mood and depression, helps improve fatigue levels. Not much out there, I have to say, as a rehabilitation medicine physician really can help with fatigue. Exercise is the gold standard treatment for this. It helps improve what we call health-related quality of life. If you have lymphedema, exercise will prevent lymphedema from getting worse. It can actually help improve lymphedema, and it actually is preventative for lymphedema as well. And I guess, again, it helps just maximize overall function. Now, probably one of the more important lifestyle factors, but not as much evidence as exercise. That's why I always start with exercise, because the amount of scientific evidence and research that has been done in exercise is just so tremendous. But probably the most important factor in our overall health and our ability to fight cancer and help improve our outcomes during cancer treatment would be nutrition, right? Literally diet. How many of you, by show of hands, have pets? I have a dog. You see my daughter there on the right with our dog. So when you go to the vet, what is the first thing the vet asks? Well, what are you feeding your pet, right? In medicine, we don't ask enough our patients what exactly there is that they're eating. But, if you think about it, how we fuel our bodies, the type of fuel that we use for energy, food is information. It's probably the most important factor for our overall health. We know that there is good scientific evidence. According to the World Health Organization, the dietary factors may actually account for up to 30% of all cancers in the Western world and 20% in developing countries. We know that having a more of a plant-centric diet or plant-based diet that consists of mostly whole foods tends to be more health-promoting and more anti-cancer than not. So non-meat eaters tend to avoid the disease. in many cases. In cross-cultural studies, we know that immigrants who go from more of a plant-based or more of a whole food-based diet, let's say from Asia, for example, and they come to the Western world, they come to America, and they adopt the sort of SAD diet, the SAD standard American diet, which is the opposite of that type of diet, their incidence of cancer goes up. So we have a lot of evidence supporting from these types of studies. One of the reasons why meat has been associated with cancers are when meat or animal flesh is cooked at high temperatures, it tends to release a compound called heterocyclic amines. These are known carcinogens. They tend to occur through the chemical breakdown of creatine when cooked at high temperatures. And another compound released in meat at high temperatures would be polyaromatic hydrocarbons. Again, when meat is cooked fast at high temperatures, grilling or broiling, tends to release more of these compounds than when meat is cooked more slowly. And then also marinating meat can actually reduce these compounds significantly. So looking into other ways to kind of cook meat, such as, sous vide, sort of boiling, just baking lower temperatures for longer periods of time, and certainly marinating meat will help reduce a lot of these carcinogenic compounds. As far as the basic principles for cancer fighting nutrition, you want to have a diet that's going to help enhance your immune system, so enhance your ability to fight off the cancer and engage these very robust immune cells called natural killer cells that actually circulate in the body and help kill off cancer cells. So we want to enhance the immune system, which we can do through diet and through exercise. And we also want to minimize inflammation or fight against inflammation, because we know that, again, inflammation tends to be a driving force in cancer itself. So the two basic principles are with nutrition are a diet that's promotes the immune system, enhances the immune system, and also is anti-inflammatory. Again, we know that inflammation not only drives cancer, but it drives really most chronic diseases, from diabetes, metabolic dysfunction, syndrome, cardiovascular disease, pulmonary diseases, arthritis, autoimmune diseases, Alzheimer's disease. I mean, you name it. There tends to be inflammation tends to be really one of the underlying causes, and tends to be chronic in individuals who have chronic disease. So what foods are pro-inflammatory? What foods do we really want to avoid? Well, really anything that you see on the slide. And what I tell my patients usually is that, if God didn't make it, then, you probably shouldn't be eating it, right? So any food that your great-great-great-great-grandmother wouldn't recognize as food, probably you shouldn't eat it. Unfortunately, in our modern day society, food has become more and more processed and more looking like more and more like what you see on the screen. Okay, so processed foods that are very high in processed carbohydrate and sugars, tend to be the foods that are most pro-inflammatory, as are processed fats and high fatty foods, especially high animal fat foods. Trans fats, for example, also found in various oils and other food additives, also very high in inflammation, promoting inflammation. Well, what foods are anti-inflammatory? Well, cruciferous vegetables, probably ranking number one as being very anti-inflammatory, also cancer fighting. They contain a compound called sulforaphane and indole-3 carbanols. These are very highly potent anti-cancer fighting foods. The cruciferous vegetables would be your broccoli, cauliflower, Brussels sprouts, bok choy, kale, and Chinese cabbage. Very, very anti-cancer fighting and cancer fighting foods. Dark berries, so raspberries, blackberries, blueberries, pomegranates, very anti-inflammatory. They contain allegic acid and various polyphenols, phytochemicals, again, that are useful in fighting cancer and decreasing inflammation. Are Alliaceous vegetables, also very anti-cancer and anti-inflammatory. They're rich in organosulfur. They counteract these compounds called nitrosamines in the gut, which have been implicated in colon cancer. So that would be, things like your garlics, your onions, leeks, in that family. Very anti-cancer foods. Our carotenoids, sorry for the dimness of this slide, it didn't really come out as I intended. So that's our carrots, our yams, our brightly colored oranges and yellow. vegetables, stimulate the natural killer cells that we talked about earlier to help stimulate the immune system. They fight off help the body fight off foreign invaders. And of course, who doesn't love our dark green leafy vegetables, right? All very high in potassium, calcium, and various minerals that we need to fight cancer and to have optimal health. And that would be our spinach, collard greens, chard, lettuces, and mustard greens. Now, don't have to necessarily take my word for it as far as where the evidence lies. This has all been analyzed by various organizations, but one organization in particular, and I highly recommend if you're not familiar with the guidelines of the American Institute for Cancer Research. They have a very robust website. They have conferences. They have a lot of patient advocate types of materials, newsletters, and things you can sign up for. A lot of really helpful and useful information. Essentially, what the American Institute for Cancer Research it's under the World Cancer Research Fund, a global organization. What they do is they analyze all the research available on diet, exercise, and environment in developing cancer and in cancer survival. So they analyze all this research, and they actually also conduct their own studies in those fields. And they compile it all, and they analyze it, and they break it down, and they come up with guidelines. Every 10 years, they update their guidelines. So they're really doing this sort of deep dive into all of the scientific evidence around diet, exercise, physical activity, and the environment, and how it plays a role in cancer survival and cancer outcomes. And basically, the updated guidelines are as follows. I'll just kind of run through them. So number one would be, be as lean as possible, right, without becoming underweight. Be physically active for at least 30 minutes every day. Limit sedentary habits. Avoid sugary drinks. Limit consumption of energy-dense foods. We talked about that earlier, the processed foods. Eat more variety of vegetables, fruits, whole grains, legumes, such as beans. So eat for I tell my patients to eat for the rainbow. Have the spectrum of the rainbow in their meal, such as in a salad, for example. Make sure you're getting every single color of the rainbow. Limit they don't say, don't eat red meat or to be a vegan per se or a vegetarian, but they say do limit it. Based on the scientific evidence, they're saying to limit consumption of red meat, that's beef, pork, and lamb. But they are saying that you should avoid processed meats, right? So those are your lunch meats and things like that, your bacon. They're saying to avoid that just because of the evidence that exists out there on developing cancer and consumption of those types of meats. If consumed at all, limit the consumption of alcohol, 2 drinks for men and 1 drink for women per day. Limit the consumption of salty foods and foods with processed with salt. Don't use supplements to protect against cancer. It's best for mothers to breastfeed exclusively for up to 6 months, and then add liquid foods later. Just we know there's a protective effect with certain cancers with mothers who breastfeed compared to those who don't. And then after treatment, cancer survivors or people living with cancers, they should, this is the guidelines for cancer prevention, but these guidelines should be followed for anyone who has the diagnosis, who's gone through treatment, and then even after treatment. Okay. So the next pillar in lifestyle medicine that would probably be important, I would say you have diet, I think would be number one. Number two, a very close second would be physical activity. And then I would say number 3 would be sleep. Sleep, it's essential, as food and water. It helps create new memories. It helps clear toxins in the brain. It helps our nervous system develop and grow and heal. And it also it really affects almost every single type of tissue. We need to have optimal sleep for our metabolic function. If we're not getting adequate sleep, it makes it much more difficult to lose weight, for example. So having poor sleep can really affect every single system of the body. It increases the risk of a variety of different disorders. It can lead to high blood pressure, cardiovascular disorders, diabetes, depression, and of course, obesity. Just some basic tips as far as healthy sleep hygiene, establishing a routine, having the same routine every night, have a wind down routine, to try to limit bright lights or screens at least an hour before bed, so no phones, iPads, or computers. Dim lights, keep the bedroom comfortable, so lower temperatures tend to be more optimal for sleep. Dark room, tends to be more optimal for sleep. Limit the consumption of caffeine and alcohol shortly before sleep, at least I would say 2 to 3 hours before sleep. Probably more for caffeine, probably not past 12 noon. Get regular physical activity has been shown to help with sleep. Mealtime, finish at least 2 hours or so before going to bed, and obviously avoiding nicotine. So some substances that can really disrupt sleep would be caffeine, nicotine, alcohol, chocolate. I like dark chocolate. That's my treat after dinner. But I do notice that sometimes if I have too much dark chocolate, I do like the 88 or 90% chocolate. Sometimes I do actually know that it does disrupt my sleep. So be mindful of that. Spicy foods, acidic foods also can affect sleep. Next, in the lifestyle pillars, we have stress mitigation strategies, and just stress in general. I do see in my practice, cancer itself is obviously very emotionally, can be an emotional upheaval for a lot of people. Understandably so. It can be a very disruptive type of experience. There's a lot of stress associated with the diagnosis. So we do encounter this in the practice a lot. We do need to address it effectively. There are a lot of sort of good techniques out there to help minimize or mitigate stress. So one of the strategies that I really like a lot are this concept of mind-body stress reduction, mindfulness-based stress reduction. It kind of draws from ancient healing practices such as traditional Chinese medicine, Ayurveda, and Tibetan Buddhism. The basic premise is that the mind and the body are connected. They're not distinct entities. Thoughts and emotions can impact our actual physical state. Thoughts lead to feelings, and feelings lead to actions, and actions lead to the types of results that we see in our life. So this is all kind of taken into account with mindfulness-based stress reduction. Some techniques that are used are mindfulness-based meditation, transcendental meditation, mantra-based meditation, guided meditation, biofeedback, hypnosis, yoga therapy, tai chi. All can be good, viable practices for stress reduction. I like the work of Dr. Jon Kabat-Zinn. I was fortunate enough to attend several of his seminars while I was a resident in Boston through the Cambridge Insight Meditation Center. I find his work to be really fascinating, and he was really amongst one of the first Western scientist-based people to kind of talk about MBSR or meditation. He started the first mindfulness-based stress reduction clinic out of the University of Massachusetts in Worcester, and has written many books. The book that you see on the slide here is his first book. It's called Full Catastrophe Living. I highly recommend it. He has courses online, variety of different resources, and on this technique of mindfulness-based stress reduction. So a form of meditation, it can really be an effective means for helping to manage stress. And essentially, mindfulness means paying attention in a particular way on purpose in the present moment, and then in a non-judgmental manner. Another techniques that I like are various breathing techniques. There are several. There's box breathing. There's various forms of yogic breathing, fire breath, etc. The one that I use a lot in my practice is very easy to learn, very simple. It's a 4-7-8 breathing technique. And I find that it can be a very effective tool when people are stressed in the moment. If they're able to do this technique, it instantaneously can kind of put them into a relaxed state. Essentially what the technique is, the video on the left, you see there, that screenshot is Andrew Weil, who is a integrative medicine, sort of the grandfather of integrative medicine in the United States, has written many books. He does an amazing demonstration of this technique. If you look on YouTube, if you just search Andrew Weil, MD, 4-7-8 breathing, it'll come up. But essentially, it's a very simple technique. You take the tip of your tongue, you put it behind your top central incisors, right behind your front teeth on your hard palate there. And you breathe in for a count of 4. You're counting in your mind. You hold for a count of 7. You can do this with the eyes closed or eyes open. And then you breathe out with your lips pursed as if you're blowing out a candle for a count of 8. Breathe in for 4, hold for 7, breathe out for 8. Repeat that cycle about 3 to 5 times. I'm telling you, it works amazingly to help reduce stress. I'm going to end there and take any questions that you may have. Thank you so much for your attention.